Welcome to the Broward County Health Department. It is my distinct honor and pleasure to introduce Congresswoman Debbie Wasserman Schultz, who will speak to us today in recognition of Cervical Cancer Awareness Month. Congresswoman Schultz.
Thank you so much. Good morning. I'm really pleased to be here with accomplished professionals and with Marjorie, who is a survivor of cervical cancer. With me today are Dr. Paula Facci, who you just met, the Director of the Broward County Health Department, Dr. Aaron Elkin, who's an OBGYN and the past president of the Broward County Medical Association, Barbara Effman, who just became the past president of the Broward County chapter of the American Cancer Society, and Marjorie Evans, who is a survivor of cervical cancer, and she's going to spend a few moments sharing her story with us. I'm looking forward in a little while to a tour of the Broward County Health Department's Florida Breast and Cervical Cancer Early Detection Program. This cutting-edge facility provides critical breast and cervical cancer screening exams and treatment to women who need it most. Each January, we mark National Cervical Cancer Month with awareness events like this one. This awareness and education is crucial. More than 12,000 American women are diagnosed annually with cervical cancer, and more than 4,000 women die from cervical cancer each year. Like any cancer, cervical cancer is best treated if caught early. So this month is the perfect time to remind the women in your lives to get their annual pap smear tests. This simple procedure helps identify cell abnormalities before they develop into cancer and has increased the cervical cancer survival rate to 70%. Pap tests are fast, simple, and widely available, and now there's really no excuse not to get one. In August, President Obama announced that as a part of the Affordable Care Act, women will be able to access free preventative care, including pap tests and a yearly well woman visit. So now, once the Affordable Care Act fully takes effect in 2014, women can get a free pap test in addition to mammograms, colonoscopies, and free contraceptive products. These will be available without a copay. This is in addition to banning insurance companies from denying care based on pre-existing conditions like cervical cancer, as well as breast cancer, pregnancy, having had a C-section, or having been a victim of domestic violence. All of these things are things that insurance companies characterized as pre-existing conditions. I mean, imagine being a domestic violence victim was considered a pre-existing condition in some cases. In other words, the Affordable Care Act makes it so that just being a woman is no longer considered a pre-existing condition. Of course, there's really no better tool than prevention. Cervical cancer can be caused by HPV, or human papillomavirus, which is the most common sexually transmitted infection in our country. Approximately 20 million Americans are currently infected with HPV, and at least half of sexually active men and women get it at some point in their lives. According to the National Cancer Institute, widespread vaccination against HPV has the potential to reduce worldwide cervical cancer deaths by as many as 2/3. There are two vaccines, Cervarix, which is approved for young women, and Gardasil, which is approved as an immunization for both males and females. The Centers for Disease Control and Prevention has recommended that the vaccine be administered routinely at ages 11 or 12, and I can assure you that it's safe and effective because my 12-year-old daughter just had her second round of vaccine. The Affordable Care Act ensures that both vaccines are covered by insurance plans so that all young men and women have the opportunity to access this critical healthcare tool. We need to help spread the word about programs like the Florida Breast and Cervical Cancer Early Detection Program, which offers free screenings for women. But there are far too many women that don't know about the program, and we need to continue to increase the amount of funding available so that we can make sure that all eligible women are able to get access to the screenings. Over the last decade, thousands of women have benefited from these screenings, and as many of you here today know, early detection of any kind of cancer, as I said, is the key to treating and defeating it. And that's why funding for these kinds of programs is so important. And rest assured that I'll continue to push for federal funding in hopes of increasing Florida's rates of early detection and saving more women's lives. As a breast cancer survivor myself, I know the importance of prevention and early detection. It can literally mean the difference between life and death. I found my lump in a self-exam just 6 weeks after a clean mammogram. That proves, I'm personal proof, that when it comes to health, vigilance is essential. So I'm committed to making sure that my constituents have all the information and the resources that they need to keep themselves healthy. And I will continue to fight, not only here in South Florida, but in Washington, to ensure that Congress does its part in fighting these terrible diseases. That's why I'm so thankful that we have such brilliant minds working right here in Broward County, and I know we're all looking forward to hearing what Dr. Thachey and Dr. Elkin have to share with us today, along with Barbara Effman and Marjorie Evans. So thank you again, and with that, I'm going to turn it over to the experts. Dr. Thachey, thank you.
Cervical cancer is the second most common cancer in women worldwide. From a national perspective, in the United States, cervical cancer incidence and mortality rates have actually decreased by 67% over the past 30 years. Most of this reduction is due to the Pap test. Between 60 and 80% of women who are diagnosed with advanced cervical cancer have not had a Pap test in the past 5 years. And for women in whom precancerous lesions are detected early, the survival rate is nearly 100%, with proper evaluation, treatment, and follow-up. Cervical cancer is now one of the most successfully controlled cancers, and the HPV vaccine, which Dr. Elkin will discuss, will contribute to decreasing the occurrence even greater. Women should ask their healthcare providers about cervical cancer screening. The National Breast and Cervical Cancer Early Detection Program was created in 1990 to increase access to breast and cervical cancer screening, and the program operates in all 50 states. In Florida, the program is known as the Florida Breast and Cervical Cancer Early Detection Program, and it is administered by the Florida Department of Health. The program provides education and outreach for women and healthcare providers, screening, tracking, and follow-up, including mammograms, clinical breast exams, and Pap tests, some diagnostic procedures, case management, and treatment through application for Medicaid. All 67 counties in Florida have access to this program through the 16 lead sites, and Broward is very proud to be a lead site covering Broward County, Palm Beach, and Martin County. The program serves women who are ages 50 to 64, uninsured or underinsured, at or below 200% of the federal poverty level, a woman of any age with a history of breast or invasive cervical cancer who meet the criteria, or any woman under 50 who's referred for a highly suspicious clinical breast exam. Since 1994, the Florida Breast and Cervical Early Detection Program has served almost 70,000 women with breast screening and other related services, and over 47,000 women with Pap tests and related services. In Broward County, the Broward County Health Department leads the program, and we work in partnership with Memorial Healthcare Systems, Broward Health, Family and Community Health Centers, Holy Cross Hospital, and many other healthcare providers. We also provide Pap tests through our women's health services here at the Health Department. The Broward County Health Department strongly encourages women to learn about cervical cancer and to consult their healthcare provider about screening. More information is available at our website, browardchd.org.
Thank you very much. Now I'd like to introduce Dr. Elkin, who is the past president of the Broward County Medical Association and an OBGYN.
Thank you. I'm very thankful for this opportunity for us to be addressing a medical issue in the United States. Cervical cancer and cancer prevention and screening is one of the criteria that we look at in the United States to gauge health care. Screening through routine checkups and prevention programs is essential. I'm very thankful for the Health Department and for the Congresswoman to stress this issue and stressing that the Patient Protection and Affordability Act, an Affordable Act of 2010, has ensured that women and men and citizens of the United States are going to have prevention programs regardless of the ability to pay. This is an essential program and programs and initiative that will ensure that our citizens in the United States are going to reduce suffering and ensure their well-being and health. As the Congresswomen have expressed, the Patient Protection and Affordable Act has recommended prevention and recommended screening. Screening and prevention is recommended by the medical profession to ensure our well-being. through routine screening, specifically as we talked today about cervical cancer and cervical precancer, we can reduce the suffering and we can increase the well-being of our citizens. HPV vaccination, which is available today, is a preventative measure. There are many things that we are talking about in healthcare, and we are thinking about treatment, and we're recommending patients to have regular checkups, but there are things that we can do to actually prevent illness. One of them is getting pap smears, routine pap smears, and one of them is actually vaccination. At Broward County and the Broward County Health Department, the Broward County Medical Association have created an immunization task force. We are encouraging women to actually get preventative care and actually have screening. Screening for cervical cancer through routine pap smears have reduced cervical cancer by 70% in this country. Cervical cancer is still in this country. Cervical precancer results in millions of women undergoing testing and treatment for precancer disease. We have today the availability of 2 vaccines that will reduce the rates of precancer, and will reduce the rate of suffering and illnesses, and reduce the rate of cervical cancer. These 2 vaccines are available. The Broward County Medical Association, me as an OBGYN, have seen a woman suffer through years and years of precancer testing, precancer screening, precancer intervention, and I've seen women die from cervical cancer. Screening, routine screening, prevention is immensely important, and I think this month, and thanks to the Health Department and the Congresswoman, we're going to stress the encouragement of all women, including actually males. The CDC panel has actually recommended also boys to actually be vaccinated for HPV, as both the physician and the Congressman has stressed. So at this point, I would like to thank everybody. I would like to stress that this is an opportunity for us to educate our citizens about routine screening with pap smears and routine vaccination to prevent precancer and cancer illnesses in our citizens in the United States. Thank you very much for this opportunity.
Now I'd like to introduce a very special person, someone who is what I consider to be a volunteer leader extraordinaire. She devotes much of her volunteerism to promoting health, supporting the public health system, is a master in public health herself, and a real advocate for women and their health. Barbara Effman, the immediate past president of the Broward County chapter of the American Cancer Society.
Thank you. I'd like to thank the Broward County Health Department first for hosting this event, and to Congresswoman Debbie Wasserman Schultz for her leadership and advocacy to educate women in our community about cervical cancer and the importance of how early screening prevents cancer. In 2012, the American Cancer Society estimates that in the United States, approximately 12,710 new cases of invasive cervical cancer will be diagnosed, and approximately 4,290 women will die of this disease. Cervical cancer used to be the leading cause of death for women in the United States. However, in the past 40 years, the cases and the number of deaths from cervical cancer have decreased significantly. The 5-year survival rate for patients diagnosed with localized cervical cancer is 91%. This decline is largely the result of women getting regular pap smears, which result in early detection and cure. In the United States, cases of cervical cancer occur most often in Hispanic women at a rate that is more than twice that seen of non-Hispanic white women. African American women develop this cancer about 50% more often than non-Hispanic white women. When detected early, cervical cancer is one of the most successfully treatable cancers. The American Cancer Society recommends cervical cancer screening for women 18 and over approximately 3 years after a woman begins having vaginal intercourse, but no later than the age of 21. Screening should be done every year with conventional Pap tests or every 2 years using a liquid-based Pap smear. The American Cancer Society is actively involved in providing credible, unbiased information to the public and to the healthcare providers. For information on this or any other cancer-related topic, feel free to call our 24-hour, 7-day-a-week hotline at 1-800-ACS-2345. Thank you again for letting us participate in this National Cervical Health Awareness Month program. It is my hope that together with education, awareness, and research, we will celebrate more birthdays. Thank you.
Last but not least, I want to introduce Marjorie Evans, who, although I just met her a few moments ago, I consider a sister survivor. Because when you have survived any kind of cancer, you are a true warrior. And it is special and brave of Marjorie to join us this morning to help raise awareness. I know as a breast cancer survivor myself, I have considered it important for me to use my own experience with breast cancer and early detection to help other women not have to go through what I went through, and I know that's why Marjorie's joined us here this morning, and I want to introduce her and give her a few moments. Thank you so much, Marjorie.
I have let the experts talk about statistics. I'm going to talk to you about me. I was diagnosed with breast cancer about 13 years ago. I was 10 years out of the breast cancer, had a Pap smear, and was diagnosed with cervical cancer. I would like to speak personally to those who were involved with having cancer. The thing that helped me survive this was, first of all, I had a good support system. I had a nurse practitioner who attended every appointment with me so I could get a clear idea of what was actually going on in my body. I also took a look at the rest of my life and what was going on in the rest of my life, and I went to Duke Integrative Medicine and participated in programs to help me deal with the impact of this on my brain. I got 2 different protocols, one from a local doctor, one from Sylvester, and I also sent off to MD Anderson, and all of the protocols were different. So I chose the protocol that I felt in cooperation with my physician would be the best path for me. I took hypnotherapy, I did yoga, I walked every day. I'm a very, very strong woman, but I needed support through this ordeal. And I needed also support from my peer group, other women who had had this disease. And I strongly recommend, if you're alone out there, you get down to Gilda's Club, because when I get the notification that I have to go through the CAT scans again, or they found something that doesn't look quite right, those ladies down there, some of them have been through it 5 times. They can really help you calm down, basically, and look forward to whatever life that you have. So I am very grateful for this opportunity to be able to tell all of you women out there, you can do it, but take care of your whole body while you're doing it. Thank you.
We'd be glad to take any questions.
Regarding the cost of vaccines, is that part of the prevention program that you were talking about, or because I know they can be costly?
The HPV vaccine is available without cost to children under the age of 19 through the Vaccine for Children's program.
And
that's available at the health department and also at other public and private healthcare providers.
right. So above that age, then no.
Above that age, folks can visit their federally qualified health center or other public providers and investigate what the cost might be and what discounts or sliding fee scales might be available.
And also because the Affordable Care Act, as it kicks in fully by 2014, will cover everyone. Whenever everyone is covered with healthcare insurance, then those vaccines will be available and without co-pays as well.
Just to make a comment about that, in the private sector, in terms of patients who are insured, the majority of insurance companies do cover HPV vaccination. Sometimes there is a copay, sometimes there isn't. The access to it can be reduced by some insurance companies that do not cover vaccination. So the Congresswoman is correct. When we are going to get to the point of having all insurance companies cover immunization and prevention, it's going to be very beneficial.
And I know you mentioned your daughters got the. Talk a little bit about that, because I know that when these shots first came out, a lot of concern, a lot of parents still questioning whether this is the way to go with their kids.
Well, I have twin 12-year-olds, a boy and a girl, and my daughter just got her second vaccination. I believe it's a 3-shot. Yes, so I have one more that I need to take her for. I didn't hesitate at all. For me, the opportunity to take most of the possibility of her ever getting cervical cancer off the table through this vaccination far outweighed any concern that I might have had about the risk of the vaccination, which is infinitesimally small. And in fact, I mentioned I have twins, a 12-year-old boy and a 12-year-old girl. I intend to get my son vaccinated as well, because this is among the most common, human papillomavirus is the most common virus in the entire country among men and women. And so I think it's important for boys and girls to get the vaccination, because you don't want, any opportunity we have to reduce the spread of that virus is an important one.
To comment about safety, both the CDC and the FDA have looked at safety record of both vaccination, and the safety record is excellent. There are risks in life. I always say that life is risky, but prevention and screening and immunization is critical to prevent that. What's more important to also remember is that it's not just about cervical cancer, but it's about prevention of cervical disease that causes women and teenagers to go through years and years of intervention that may actually be harmful. So first, do no harm. If we can prevent even early disease, early cervical HPV changes, and also in boys that are participant in that. There's a combination of both boys and women. If we can increase the immunization rate with vaccination, which appears to be safe, we don't know everything about vaccination. We have more studies that are coming out, but at this point, my encouragement and my recommendation, as well as the FDA and the CDC, is to immunize both women and men, girls and boys, to prevent precancer and cancer.
You know, Diana, let me also add, there are certain groups of people who have a heightened risk. I, for example, when I was diagnosed with breast cancer, also went through the BRCA testing, the breast cancer genes, and I'm BRCA2 positive, which means that I had an increased risk for different kinds of cancer. I'm not sure if BRCA2 is an increased risk of cervical, but I believe BRCA1 is. And so for groups like Ashkenazi Jews, like certain Hispanic groups, African American women, if you are at higher risk because of a genetic predisposition to cancer, for me, my children are potentially, if they're carriers, we don't know yet, but if they're carriers, they're also, and I wouldn't have them tested for those genetic mutations until they're adults. But for me, the vaccination is even more important for my kids because of the potential increased risk, since I'm a gene mutation carrier. So that's something else to think about. And it's all about awareness. And I'm lucky. I know about the increased risk in my family, but we have a large majority of Americans that don't know about what genetic mutations they're carrying, because even access to those screenings are cost prohibitive. So just generally, that's why it's great that there's Cervical Cancer Awareness Month, an opportunity like this to raise awareness. Anything we can do to raise awareness and make it more likely that someone goes down. I mean, we know that just from us doing this press conference, that there will be women and men or moms who will take their sons down and get them an HPV vaccination, or women who will get screened simply because they heard this report. And that means that we've prevented some cancer. And that means we saved lives, and it's really critical. Anyone else? Thank you all so much.